Hi, my name is Coventry, and today I'll be talking to you about lower back pain. When a patient comes to our centre with lower back pain, your osteopath will first want to find out how the injury occurred. Sometimes this is not obvious, but we will ask questions to try and find out the source of the pain and whether there are any other contributing factors to the pain. We'll ask the patient about aggravating and relieving factors, so we'll want to know specifically what movements or activities aggravate the pain and what things have helped. So have there been any medications that have helped? Has hot or cold therapy helped, or have they had any other treatment? From there we'll take a detailed history, and we just want to know about the patient's general health, whether there have been any other injuries in the past that may relate to this current complaint that they're coming in with. We'll also ask about any other symptoms that can occur with lower back pain, and this can include pain that spreads into the leg, numbness and tingling or burning pain in the leg, and we'll also ask about bowel or bladder symptoms, as sometimes this can indicate that there's a more serious nerve injury. From there we will do an examination of the patient where we'll look at some specific movements and just ask the patient how they're feeling throughout. Can I just get you to bend forwards for me, Simon? Very good, and just coming back up, and then can I get you leaning to the left and then to the right? Good, and just leaning back, and I'll support you there as you lean back, and straightening up, giving yourself a hug. And just as I put my hands on your hips, turn to the left and turn to the right. Good, and facing straight ahead and arms down. Good. So from there we may conduct some other special tests, such as some strength tests or some nerve testing if we feel it's necessary. And after we've conducted all our testing, if we feel that it's safe to treat the patient and they don't need any other referral, then we will start the treatment. We'll also have a feel of the joints and assess the joint range of motion through the hips, lower back and pelvis. And from there, once we've got an idea of what's going on, we can start the treatment and we can explain the treatment plan to the patient. After we've completed the treatment, we will speak to our patients about any other strategies that they can implement at home. Sometimes we'll show them some exercises to help with managing their injury or complaint, and we will also advise on ergonomics, workplace setup, and the use of heat or ice to help with pain relief. We'll also talk about the expected recovery time frame for their injury. So after we've finished our treatment, we will talk about some exercises that might be helpful for the patient, and we'll also go through some ergonomic advice, which may include adjustments to workplace setup or desk setup at home, for example. We can also discuss whether the application of heat or ice may be helpful, and whether any other referrals are necessary at this point in time, such as back to the GP. And from there we'll also discuss the expected recovery time frame for the patient's complaint. If you have any other questions or queries, or you'd like to know more about what we do at ATUNE, you can have a look at our website at www.atune.com.au.